That always freaks me out. I don't know why it has to be so loud when it says that. Anyway, so if y'all don't mind, try to, if you have any questions, just go ahead and put them in the chat. I may wait until I get to the end of the presentation to answer them, just because we have a lot of information to cover. And I'm just going to go ahead and jump right in, but one way or the other, I will see the chats. So I'm going to start and share my screen with y'all, hopefully. Let's see if I can get this going. Fortunately, it's smarter than me and it tells me which screen I'm supposed to share. So thankfully. So anyway, we're going to talk about the opioid settlement and give you guys an update today. What we're going to talk about the current status of opioid settlement funds, some potential uses, which this is going to be an evolving topic, but I'll save that discussion for later, and some potential future settlements. One thing that I want to make sure I emphasize in today's training or discussion is that there will be other settlements coming. And all of those are encompassed in KRS 15 291 through 295. We're going to talk more about that as we go along today. So getting down to the current status, one of the things that y'all have already, most of you have done, is we're going to talk about the registration with Brown-Grier, talk about current opioid settlement distribution, reporting requirements, which are coming up, timeline for future distributions, and we're going to talk a little bit about the state opioid abatement funds and what cities can do to either encourage nonprofits or to apply for them yourself. So Brown-Grier is the administrator of the National Opioid Settlement between government entities and named opioid distributors, as well as Johnson & Johnson. That's important because y'all are getting emails from Brown-Grier. So it's not spam. When they first started coming through, and we don't always know when these emails are going to come through, I did get a few questions. Hey, is this real or is it spam? That's a fair question, by the way, because we all get so much junk mail. But Brown-Grier was deemed to, as the administrator of the fund. What that means is that they have to disperse all of the opioid settlement funds for every entitled entity throughout the United States. So any entity that was covered by the opioid settlement, that national settlement with the distributors and Johnson & Johnson. It's a structured settlement agreement. The reason I mention that is it's important to know that there are specific things that need to occur for anyone to receive a payment. It's kind of like it's like this 400-page document. So it's got a lot of little hooks in there, ways that we can mess up and not get our money. That's one of the reasons it was beneficial for the state that the Attorney General's office kind of said, okay, yes, as a state, every local government is going to opt in, because that took away some of the guesswork. There are still some potential aspect of the agreement that could impact long-term receipts. So that's why we can't really give you a specific amount that you're going to get for the next 18 years or the next 9 years. A few cities have still not registered with Brown-Grier, even though Brown-Grier sent the email last fall. If you're one of those cities, please email me. I will put you in touch, or I will get in touch with the Attorney General's office and have Brown-Grier reach out to you. So if you signed the first settlement distributor and sent it to the AG, distributor in J&J, and then you got an email and you don't remember signing on, then let me know. Usually the Attorney General's office is going to call me and I'm going to reach out to y'all and say, hey, we don't think you've signed on. Brown Greer is required to disperse the settlement funds according to the formula approved by the federal judge during the settlement. And I got a lot of questions from cities about that too, about, well, we think we should get more than this other city over here. Well, we had no control over what that formula was going to be. That happened up in Ohio during the case. The federal judge determined what that formula was going to be. That formula applies to everybody. So I hate it that there are some cities that feel that way, and you may be right, but that formula is what we have to live with. All right, the current distribution, and this is where there's been some confusion. On December 15th of last year, Brown Greer distributed 2 years worth of payments, and that was for, those are your 2022 payment. However, there was a lot of confusion because Johnson & Johnson, you guys received 5 years of your J&J payment for those of you who are entitled to receive it. I've got a lot of questions from cities. We got too much. This was a problem. Well, Johnson & Johnson just decided that they wanted to front load their payment. So for those of you who aren't as familiar with the opioid settlement process, when this settlement, the distributor and the Johnson & Johnson settlement occurred, the distributors as a whole, they decided to spread their payments out over 18 years. Johnson & Johnson decided that they only wanted to spread theirs out over 9 years. So apparently they decided they wanted to go ahead and pay 5 years up front. And we didn't really have much notice of that until either the checks were cut or you got that direct deposit. Pursuant to, some of you cities may not have gotten both, or you may not have gotten any. Now, that's because only cities that were to receive at least $30,000 from each settlement portion, based upon those class metrics that I talked about in the last slide, those are the only cities that are going to receive those funds. So some cities, for example, may have been entitled to at least $30,000 from the distributor settlement, but maybe they weren't from the Johnson & Johnson. So you only got those 2 years from the distributor settlement. Eligible cities that have not yet registered with Brown Greer are going to receive less money than what is estimated for that 2-year payment and that 5-year payment that's on our website. And that's because of those sliding benchmarks that I talked about in that settlement agreement. So if you haven't yet registered with Brown Greer, again, let me know so that we can reach out to you and get that taken care of. Let me make sure. Oh, and Stacy Clark said the emails that she received, that in the title, it says National Opioid Settlement and not Brown Greer instead of that. And I had another question about, I haven't received the email. How do I check that you're a new mayor? The previous mayor would have been the contact on that. You can email me at mpatterson@klc.org, and I can check with the AG's office to make sure that registration has occurred and the like. Okay. So reporting requirements. These are coming up now. So both under the distributor settlement agreement and the Jensen, they call it the Janssen agreement. I think that's J&J's parent company. But the Johnson & Johnson, they both require quarterly reporting. That's part of that. So it is incorporated into state law through 15239 and a regulation promulgated by the Kentucky Office of Attorney General, the Opioid Abatement Committee. And I will send y'all will get a copy of this, of the PowerPoint afterwards, just to let you know. Reports have to be submitted to the Attorney General's office by March 31st. Then there will be another one June 30th, September 30th, and December 31st. So each year on the Opioid Abatement Advisory Commission form, and it is not burdensome. One of the things that we like to mention, or that I like to mention, is this is not like ARPA funds. This is not like CARES Act funds. You have to make sure that you are using these funds for qualified purposes under the statute, but you don't have to hold on to every receipt and every little comma, and you also don't have to spend them right away, which we're also going to talk about here in a sec. So this is just to show you that the reporting is not burdensome. This is the form from the Office of Attorney General. This is what you're required to submit on March 31st. All it is, hey, this is how much we received. This is who's authorized to receive it. Here's our information. Oh, and by the way, I'm going to swear that we're only going to spend it on qualifying projects. And then it does have to be notarized. So that has to be sent then. So there you go. All right. Now, another issue that we had is that some cities should have already received an email from Brown Greer about mandatory reporting for funds used for other than opioid abatement purposes. This report refers to opioid settlement funds set aside to pay attorney's fees. So it doesn't mean that we're going to use the money for anything aside from opioid abatement. It's just that as part of the agreement, 85% of the settlement monies are required by the agreement and mandated under Kentucky law to be used for opioid abatement purposes. 15% of it is used to pay attorney's fees. So what happened is Kentucky decided that they were going to, by statute, create the local government fee fund. That took 15% from all the collective local government shares and put it into a pot that's administered by the national settlement, okay? And that's to pay the attorney's fees. So, and that is the maximum amount that can be used to pay for attorney's fees. The rest of it has to be used for opioid abatement. And that's in KRS 15295. I try to give you guys the statutes when I have them. Cities cannot use individual opioid settlement allocations to pay for attorney's fees. So two important factors here. You're going to get an email and probably don't have to worry about it, okay, from Brown Greer. So don't worry. I've already gotten an email about that. And the second one is that the attorney's fees from the settlement, there's already money set aside to pay for them. Okay, so you don't have to worry about that either. And that goes through that local government fund, and that 15% is already accounted for. So on March 1, cities are probably you should receive an email stating that the state has requested that Brown Greer report all disbursements that are used for attorney's fees. So the only portion of the money that can be used for anything aside from opioid abatement. And if that changes at any point, I'll let y'all know. But as of right now, that report that's due on March 31st through the email that you're going to receive from Brown Greer, you don't really have to worry about that. Okay. You just have to worry about the one that you're reporting to the AG. Okay. I think we might have another question. Okay, this is from Dennis Winters. He was asking about Rubrus Incorporated. We're gonna get to Rubrus at the end, so don't worry. And Teresa, you asked when will we get the required form to use? It's on this webinar, and it's also on the Attorney General's website, which I link you to here shortly. Okay. So, timeline for future distribution. I know this is what everybody's asking. So cities are going to receive the next payment on July 15th, 2023 for the distributors. Okay. You're not going to receive another payment for the J&J settlement for 5 years because they front loaded their payment. Any estimates on future amounts are speculative. I shouldn't necessarily say purely speculative, even though I got kind of froggy with the language, but we know approximately what they will be, but there are still so many factors that go into determining what your future disbursements will be, that not even Brown Greer will release any estimated disbursements. So for the purposes of projecting future revenue or what have you, you're going to have an idea in advance of your budget. However, I would not really count on a specified amount, because there are so many triggers and so many variables that go into that calculation. We do get a heads up a little bit in advance of when the disbursement is coming. So we will know prior to July 15th, and we should be able to give you those amounts in advance of your budget. If not, then, as you know, you can do estimated revenue based upon the last payment that you received. All right. So any questions there? Okay, state funds. The other 50% of the entire settlement that Kentucky has been allotted, it goes to the state, but also has to be used to address the opioid epidemic. Anyone can apply for the grant, and this is where I link to the website. And this also includes, if you go to this webpage, the Tackling the Drug Epidemic webpage, you will find the report there. It has a column, a bar on the right-hand side, and it has 2 of the regulations, and then it has the reporting form that you'll use for March 31st that was in the slides from earlier. Okay. Eligible applicants can include any entity or governmental agency that submits a qualifying application. A qualifying application just means an application with a project that meets the requirements of the statute. Okay. And the entity cannot be debarred or suspended. So you can't be banned or suspended from contracting with the state. Those are the basic requirements for submitting an application. Now, those applications still have to go to the Opioid Abatement Committee or Advisory Commission, and they vet them. They kind of walk through there and award projects based upon some criteria. So funds are awarded based upon available funding and specific criteria that we're going to talk about. So these are some considerations that are in the regulation. This is an emergency regulation that is on their website, and I can also send anybody a copy if they're interested. The considerations that the commission takes under advisement in analyzing the petition and awarding funds includes compliance with the law, a record of effective utilization of past funds. So states or cities and counties, any local government, y'all can also award grant funds or partner with other entities for opioid abatement purposes. But if you've awarded those funds previously and then they go to the state and ask for them, the state's going to take into consideration, hey, what's their track record, right? Which kind of makes sense. So the effective utilization of any past funds from anybody, the geographic reach of the application. So they're going to look at how many people is this going to serve? Is it an underserved area? Is it an area that was hit particularly hard by the epidemic? Previous amounts received from the state or local government. So not just how were they utilized and how effective were they utilized, but how much did you get and why do you need more? Utility and effectiveness of the application itself. So they're going to look at the new project standing on its own. How effective is it going to be at targeting an opioid epidemic? And the extent to which Kentucky residents are served. Extent to which prior commission allocations serve similar purposes. So the commission isn't putting all their money, all their eggs in one basket necessarily. The extent to which underserved population would receive services. So they're going to be kind of analyzing, where are the services currently being offered? Is this, are we talking Lexington, or are we talking an area where there aren't many service providers for opioid abatement? And the extent the application seeks to educate the public, reduce misuse and use of opioids, treat opioid use disorder. So you'll see a lot of OUD. OUD stands for opioid use disorder. So in the statutes and in the regulations, you'll see that. And then it will say, or SUD, and that's substance use disorder / mental health. In the statute and in the regulations, it's really focused on using the money to target opioid use disorder or co-occurring. So still have to have the opioid use disorder, but maybe you also have substance use disorder and mental health that co-occurs with opioid use disorder. And to combat the effects of opioid use disorder, substance abuse disorder, mental health, and promote resistance, again, kind of as a community. And the extent that the application aligns with accepted evidence-based practices. If you look at the Opioid Advisory Commission, there are a lot of practitioners, there are former narcotics officers, Van Ingram's on there. There's some others on there who practiced on both sides of the fence, both administrative and law enforcement. And they're all going to have a lot of knowledge and information on what the evidence-based practices are that have been shown to be most effective at combating the opioid use. And then sufficiency of documentation to validate how much they're requesting. All right. Okay, are y'all ready to talk about potential uses? I know this is what everybody's concerned with. But I had to give you all the other information too to get here. Okay. As I mentioned, unlike federal grant monies, the opioid use monies will not expire. So cities are under no obligation to spend these funds immediately. And I mention that because anytime we get a pot of money, and I'm the same way at home, anytime I get a pot of money, it burns a hole in my pocket, right? I love the fact that we've gone to credit and debit cards in our culture because cash slips right through my fingers. Cities are under no obligation to spend them. And the national settlement with distributors and J&J do include a lot of restrictions on how the monies can be used. Monies expended contrary to the restrictions can result in a distributor or Johnson & Johnson challenging the settlement, which we don't want because, like Marlon said at the beginning, we all want the money, right? And we all have communities that were negatively impacted by the opioid use epidemic. KRS 15291, which contains all of these restrictions, those restrictions came directly from the National Opioid Settlement, and those were incorporated into state law. So those aren't anything that the General Assembly made up to make our lives difficult. Instead, that came directly from the federal settlement, which in some ways can make our lives difficult. But I tried to divide. I didn't take the potential uses of opioid settlement in order because I didn't think that was as helpful. So I tried to break it down first off by services the city is currently providing that you could use the money for, and then other eligible uses. And within the eligible uses, the other ones, you're going to see some that are highlighted in yellow. And the reason I highlighted them in yellow is to caution you. And not that you couldn't come up with a project that could fall under that, but the ones that I highlighted in yellow mostly would have some level of state involvement. And I'll talk about that as we go along. So the first one, emergency response services provided by law enforcement or first responders. I've gotten some questions about how do we track that? How do we figure this out? Well, you figure it out by tracking your 911 calls. What are your call logs saying? How much, have you made a record of your Narcan uses? Do you know when opioid use and substance use has been involved in one of the calls? And a lot of times you're going to be able to get it from those records. Any portion of the cost of administering opioid antagonists, so the Narcan, naloxone, any cost associated with doing that. So that can be the purchase, that can be training to administer the Narcan or naloxone. I'm not going to be able to say that very many more times, apparently. So any costs associated. Anything that supports the education of law enforcement or other first responders regarding appropriate practices and precautions when dealing with opioids or individuals with opioid use disorder or co-occurring substance use disorder mental health issues. So that's going to be any training for, dealing with people that have it. That can include some portions of in-service provided, any specific trainings that officers are sent to or receive specifically with how they should deal with somebody, for example, suffering from an overdose, or someone who is suffering from opioid use disorder, but maybe is also involved in the criminal justice system. Any of those trainings, any of that education for both your first responders, so your police, fire, EMS, all of that can be paid, compensated to the city using those opioid settlement funds. Anything that supports opioid-related emergency response services provided by law enforcement or first responders. So again, any of these projects or programs. So what are we doing to train them? How are they, being utilized? Are we tracking them on the call logs, on the run logs, what have you? And provides public education about opioids or opioid disposal. So we have a lot of those public service advertisements, a lot of those public service campaigns that are handled by the police department and the fire department about, the opioid disposal, opioids, and the like. All right. See, provides drug take back, disposal, or destruction programs. I know a lot of cities have the DEA boxes. To the extent that there's a cost involved, or if the city wanted to work on its own disposal initiative, or contracts with someone to destroy the drugs from the take back program, those would also be paid for through the opioid funds. We did have one question from Mayor Dalton, excuse me. What would be the start date that we need to look at? And you can definitely use these monies going forward, but if you can document that the city has spent, that if you can document the city has spent X amount of money on, for example, the drug take back, disposal, or what have you, from the time that the settlement has occurred, then you could reimburse the city for that at a minimum. Okay, do y'all have any other questions about these specific services? I thought this was low hanging fruit, so because a lot of cities are probably already providing some of these. All right, now moving on. Other eligible services. So this is where we get a lot of questions. And again, one of the things that I'm trying to do is to pay attention to the Opioid Advisory Commission to kind of look to see what they're, how they're awarding the state money to get an idea of what types of programs are going to qualify. So a lot of these services, it would be a situation that maybe a nonprofit comes to the city and says, hey, we want to work on some outpatient residential treatment for incarcerated persons, right? Or someone who's released from jail. And the city may want to work on a grant program to fund some of these, or you may partner with a county, with another city to construct a treatment facility or what have you. The important thing to remember is that this all still has to flow through the proper procurement. And if it is a grant or, something structured in that vein, there are mechanisms that template cities can use for the grant funding as well. So let's say that you want to do something similar to what the Opioid Abatement Advisory Commission is doing and open up grants for opioid abatement programs, and you're going to have some nonprofits apply. Well, in that instance, we do have some kind of ideas, some templates that were developed during the COVID pandemic where cities set up grants for small businesses. And we do have some tools that we can use to help assist you. If you're working with another city or your county government, then an interlocal agreement would be appropriate, and we can help you with that as well. So this would include outpatient and residential treatment services, including those for incarcerated persons, and that's going to include medication assisted, abstinence-based, and treatment recovery or other services. This can be provided by community health centers or nonprofits. Projects or programs for the intervention, treatment, and recovery services to persons with opioid use disorder or the co-occurring disorders, or who have experienced an opioid overdose. So this could be counseling services, training services, and like it says, intervention, treatment, and recovery. Detox services, including medical referrals or connection to services. So you could have a situation where you have an entity or someone on staff or a counselor in your city who does have a lot of connections with the mental health or the treatment and recovery community. You may be able to provide some funding for them to give referrals, help people network to find treatment centers, detox centers, sober living homes, and the like. And then opioid abatement related housing. This is going to include the recovery homes, sober living homes, and other supportive housing. And this could be medicated, assisted, or not. And then any program that provides or supports transportation to treatment or recovery programs or services. Sometimes transportation is going to be a barrier to receiving these services, or job training and the like. So those types of services, the money can be used for that as well. Provides employment training or educational services for persons in treatment or recovery. And again, this is beneficial both to the city and to everyone in the community, because it helps them get back on their feet and get back in the community and take care of themselves. So the question, can you use the money for reimbursement of expenses like providing Narcan? Absolutely, you can. I'm trying to see. So yes, you can use that for expenses already incurred like Narcan. And again, I'll go back to the earlier slides where we talked about that. So it can be used for that. Okay. So any program or project that creates or supports centralized call centers that provide information and connections to appropriate services. So these are going to be situations like referral services. There is a Kentucky Recovery Housing Network operated by the Cabinet for Health and Family Services. There may be an opportunity to have more call centers that provide this information for people who are seeking treatment, housing from opioid use disorders or the co-occurring substance use disorder and mental health disorders. Those types of projects or programs, again, it's a place where people who are recovering or potentially recovering or seeking help could call and receive that information. Crisis stabilization centers that serve as an alternative to hospital emergency departments for persons with opioid use disorder and co-occurring disorders, or persons who have experienced opioid addiction or opioid OD. Again, these are especially helpful in areas where you don't have access to a hospital, or a hospital isn't really close by, which are a lot of our more rural areas. So you may have a request or a proposal to build one of these stabilization centers to provide that emergency care until someone can get to a full facility or hospital. Okay, and here's our first yellow. Improves a project that improves oversight of opioid treatment programs to ensure evidence-based and evidence-informed practices. The reason I put this one in yellow is because a lot of these opioid treatment programs are going to be medically assisted. And in that instance, they are likely, well, they'll have to be licensed by the cabinet and overseen by the cabinet. So I didn't put it in red. I haven't put any of them in red because we don't know what all's out there or what types of projects are going to be coming forward. But I put it in yellow because I don't yet know how much oversight cities would even be able to provide over some of these treatment programs. If it's a sober living home, maybe. We're working on some legislation to help with that. If it's an inpatient treatment program that's medically assisted, you're probably not going to have much of an opportunity to provide that oversight. So that one's in yellow, which is kind of hold off, don't get too excited about it. We'll see if the city has any ability to do that as we go forward. Another big one, provide scholarships and support for certified addiction counselors and other mental and behavioral health providers, including loan repayment and incentives to move and to provide service for underserved areas. And this is huge for a lot of the more remote cities that are further removed from the hospitals or larger treatment centers, to incentivize people to come to the city and to help, address and to help treat that population. And this can be done in partnership with a nonprofit, with a healthcare provider in your area who may come to you and say, hey, I would like to bring on more certified addiction counselors to provide these services, but I can't attract them to this area. Could I get a grant for a scholarship or for loan repayment? Or the city may do that to help attract people to the area. So again, this would be generally a partnership, maybe with Comp Care, or, I don't even know if Comp Care is a big thing anymore, but with a service provider to assist them to attract people to your underserved area. And programs that provide training on medication-assisted treatment for healthcare providers. So you may have some healthcare providers who may not be as familiar, and students or other supporting professionals. Okay, got some more yellow here. Projects or programs that support efforts to prevent overprescribing and ensure appropriate prescribing and dispensing of opioids. This is in yellow because I know that doctors and other prescribers, nurse practitioners, the like, are required to take a certain amount. I know there is a lot of oversight on their prescribing, but that's always counterbalanced if you talk to somebody in the medical field with making sure that they treat patients. If somebody has pain, they're obligated by their code of ethics and their code of conduct to treat that pain. So you hear from a lot of providers. So this is another one where it's a yellow, not a red, but I don't know how much, input a city could have. Could you provide education or optional education? Yes. Could you force them into, this type of education? No. Is there anything you can do to restrict how they prescribe? No, that's all governed by state law. So that's another one that may evolve, and we may get more information over time. Another yellow is supports enhancements or improvements consistent with state law for prescription drug monitoring programs. In Kentucky, the prescription drug monitoring program is CASPR. It's always been CASPR. As far as I know, it always will be CASPR. So that's another one that's a bright yellow because I don't know, I can't think of a way that cities could have an enhanced or improved prescription drug monitoring program because the option is CASPR. So if something comes up or if more is revealed and cities can participate in that, then we'll have to learn about it over time. Treats mental health trauma issues resulting from the traumatic experiences of opioid users or their family members. So these are going to be programs for family members with persons with opioid use disorder and services that are provided to them, either counseling services, therapy services, to help treat that trauma. So this would be another area where a city could provide grants or partner to help with that. Any program or project that engages nonprofits, the faith community, and community coalitions to support prevention and treatment, and to support family members in their efforts to care for opioid users and their families. So you can see the effort really is on all aspects of what we know about opioid use disorder and the co-occurring substance use disorders. So it's not just, hey, this money's all gonna go to target law enforcement. There's also, are we going to treat the trauma for the family and hopefully, head off future persons who may present with opioid use disorder? Or can we further support these families as they try to help their loved ones who have these disorders? And then programs that provide recovery services, support, and prevention services for women who are pregnant, may become pregnant, or who are parenting with opioid use disorder or co-occurring substance use disorders and mental health issues. So this is really targeting, well, I can't really say it better than what it says there. We have some programs in Lexington that have been very, very effective in helping children that are born addicted. So this is just to provide that support to the parents and to women who are parenting and who have opioid use disorder or those current co-occurring issues, so that hopefully they can parent their children effectively and not fall back into that. Okay. Programs that train healthcare providers that work with pregnant or parenting women on best practices for compliances with federal requirements that children born with neonatal abstinence syndrome get referred to appropriate services and receive a plan of care. We have a very good program here in Lexington through the University of Kentucky and their neonatal program. So the programs here would be training all healthcare providers to help identify the syndrome and to network to find the services that these children need. Any program that addresses neonatal abstinence syndrome, including prevention, education, and treatment of opioid use disorder and co-occurring substance use disorders and mental health issues. Trying to help those babies that are born addicted and try to stop, further issues. Programs that offer home-based wraparound services to persons with opioid use disorders and co-occurring, including parent skills training. So when we're talking about the wraparound services, we're really talking about a situation where you're not just throwing somebody into a 30-day treatment center and then, shoving them out into the world on their own. We're talking about the job training, that they may not have parenting skills. They may not know how to take care of their house. They may not know what a proper diet is, nutrition, and the like. So those wraparound services are kind of the supportive services to help them be successful. Sorry that I'm choking to that today. Supports positions and services, including supportive housing and other residential services relating to children being removed from the home or placed in foster care due to custodial opioid use. So this is to support the children who are removed from the home or in that process. And yeah. Covers the cost of administering an opioid antagonist as defined in KRS 217-186. I separated this from what we were talking about with law enforcement and with first responders because 217-186, it basically provides some measure of protection for any individual, any civilian employee, any person. So me, I could go get trained and get a prescription for naloxone or Narcan so that I could administer it if I came across someone who is in the process of ODing. So this covers the cost of administering the opioids that the city would provide, or the opioid antagonist, to the city if they wanted to provide it to anyone, to make it readily available for someone to administer if you encounter someone who is overdosing. And I know that there are some cities who are actually in the process of utilizing their opioid funds to provide naloxone or Narcan on a regular basis to students, to the general public under this section, under this provision. Okay. Supports pretrial services that connect individuals with opioid use disorders and the co-occurring use. So with the pretrial services, a lot of times that does interact with cities from the law enforcement perspective. So if it's training law enforcement to identify and to work with the prosecutors on, when would somebody be a good candidate for these pretrial services, or for, I'm going to talk a second about, actually in the next one about a new program that's coming through, but to train the law enforcement to work in partnership with the prosecutors and with pretrial diversion or pretrial services. I put a yellow on the next one. Supports treatment and recovery courts for persons with opioid use disorders and any co-occurring, but only if they provide referrals to evidence-informed treatment. As we know, cities don't have city courts anymore. So all of our courts go through AOC. There could be an opportunity to partner in your city, but a lot of times this is going to be handled by the state. I know that the state just awarded $10.5 million for a pilot program for behavioral health conditional dismissal program to divert defendants charged with specific nonviolent, non-sexual misdemeanors and Class D felonies away from jail and into treatment for substance use disorder or mental health issues. And the monies are paid to the Department for Behavioral Health to pay for uninsured and underinsured defendants to participate in the program. If someone has private insurance or Medicaid, then that would pay for their participation in the program, right, to go to treatment or to get that assistance. So I do think that a city's participation in these types of programs are going to be limited to training law enforcement to help prosecutors identify, when people might meet the criteria and the like. Then programs that provide evidence-informed treatment, recovery support, harm reduction, or other appropriate services to individuals with opioid use disorder and co-occurring issues who are incarcerated, leaving jail or prison, have recently left jail or prison, are on probation or parole, are under community correction supervision, or are in reentry programs or facilities. So this is really targeting that population who's getting ready to leave some type of structured facility, whether it's jail, whether it's some type of probation or some other heightened supervision, to help them be successful and to stay off opioids and to recover and to continue that recovery. So this would include the jobs training programs, but it could also include some other types of treatment, some outpatient treatment, therapy, any type of support. All right, and covered up. Sometimes I cover up my own buttons here. There we go. Okay. Now we get to potential future settlements. And I know Tracy asked this question earlier, so I want to make sure that she sees this. Oh, and somebody, sorry, I'm behind on a few questions. Are these restrictions going to apply to all money received from the settlement? Our attorney assigned by our county attorney said there were, yes, this is going to apply to all of the settlements. And I'm going to get to that when we talk about these potential settlements. And then I had another question. I haven't heard if you said a canine would be eligible. So I don't, in that instance, I don't know that you could justify paying for a canine out of the opioid settlement funds. I don't know how you could necessarily tie that back. But if you were paying for Narcan that was administered to a canine, yes. So I think you're probably asking if you could purchase a canine with the settlement funds. And until we get more clarity on what would qualify, I don't think, based upon my reading of the statute and of the settlement, that it would. Okay, potential future settlements. and this is not all of them. Kentucky Office of Attorney General is continuing to participate in national litigation against opioid manufacturers, distributors, and retailers. Any future settlements are going to follow the same restrictions, the same procedures, unless otherwise specified in the settlement agreement or unless the statutes are amended. Okay. On January 25th, 2023, a lot of y'all received an email from Rubris, which is the administrator. They're the national administrator for potential settlement with Teva, Allergan, Walgreens, Walmart, and CVS. And all of those also have different times, dates of distribution. Some of them are 13 years, some of them are 10, 8, what have you. It's important to register and to submit your forms to Rubris by April 18th, 2023. Okay, that's the first benchmark in that structured settlement. It's not yet final, and certain states are still kind of lingering out there and haven't yet signed on. So I got the question, so if law enforcement has bought Narcan, how far back can you go to kind of reimburse the city? I would not go past when this settlement agreement was actually reached. So that would be my recommendation. Then the question of how do we register with Rubris? Okay, hold on. You should have received an email from Rubris. Not every city is going to be entitled to it, but those who are received an email. If not, you can go to the National Opioid Settlement website, and there's a lot of information there. I didn't mean to put my whole screen up there, sorry. I'll give you the exact, here we go. Good news is I can also, so it is nationalopioidsettlement.com. And I'm going to put that in the chat. Hey, no, stealing my thunder. Okay, so here, I will put this in the chat. And that is the link you can go to, and it has information about the various settlements. So if you go to the Teva and Allergan or to Walmart, Walgreens, and CVS, it kind of walks you through how to sign up. However, to be eligible, the city would still have to receive at least $30,000 because that's statutory. So not every city is going to be eligible to receive those funds. So you should have received that email. It's important to register. And again, it's also important to know that we do not know how much y'all are going to get from this, or even if another state who could buck could tank the settlement. There's an agreement as of right now, but it could change. So much like the current monies with the distributor and the Johnson & Johnson, we can't give you specific sums because it's a structured settlement with various triggers and the like. So our email states that we will receive information how to join the new settlements in the next few weeks. They've not received an email directly from Rubris with instructions yet. We do not have an eligible list of cities for the current settlement. So we just don't have that information. So you can go online to nationalopioidsettlement.com and see if you can sign on, but it looks like you may not get that email until February 9th. Okay, so some have received a link and maybe it doesn't go live until then. Yeah, the Kentucky agreements are not ready yet. So we had some questions early on about these agreements because there was information being distributed that that there were specific amounts that were available to cities. So I'm just here to tell you that those amounts are not available yet. We can't really give you much guidance from that. Following it day to day, I talked to Chris Lewis, my contact at the Attorney General's office who handles this, at least a couple of times a week. All right. So now I have a question for y'all. please let us know of any projects that you have going on or that you're getting ready to launch about the opioid settlement funds, and email those to Michelle Hill. We're trying to at least show that cities are having some successes with these funds and highlight some projects that y'all are working on. And that's at mhill@klc.org. Even if you don't have them now, keep this email address, or I'm sure I will remind you. We will certainly have more webinars in the future. And you can email your projects once they're kind of approved and you're moving forward. This doesn't mean you need to hurry up with them. As I said, that money's not going anywhere. Okay. So we asked, should we create a subcommittee on how to use these funds or let council decide? You know, it's just going to be case by case. So that's going to be a policy decision for the city. So that'll be up to y'all. But ultimately, the council has to allocate the money and the mayor has to spend it. All right. And that's just my fun slide. So y'all can laugh, but seriously, I want your questions. Any questions y'all have, please go ahead. And if you didn't feel comfortable asking here, you can unmute yourself and ask. You can, I'm going to stop sharing now, even though I really like that one. Okay. You can unmute yourselves and ask any questions. You can email me. My email address is mpatterson@klc.org. You can call me. I think most of y'all have my phone number on here. So yeah. Hopefully this was somewhat helpful for y'all. All right, everybody's tired.
Morgan?
Yes, ma'am.
Morgan?
Yes.
Okay, I appreciate all the information. It was very, very, very helpful. I've been reading a lot of information too from the Kentucky Association of Counties and the National Association of Counties. And one thing that they suggest is that if you're going to work in partnership with your county, that you form a task force collectively, and then they have it structured of how they suggest to do that. So I thought that was a really good idea.
Well, yeah, I mean, any collaborative effort is great for the cities and counties, and it is a great way for y'all to pool money and to really maximize your impact on your cities and counties. And you would definitely, someone said you would probably need an interlocal agreement. You would definitely need an interlocal agreement in the Commonwealth of Kentucky to do that. And we talked about that earlier, and we have a ton of models for interlocal agreements that we can help you with.
Yeah, and that was included in their suggestion as well. Yeah.
Awesome. Okay, y'all. Well, I'm not going to keep y'all on here. It is a beautiful day. I'm hoping, I know Mayor Hughes is going to go out on his back deck and enjoy this beautiful day. I hope y'all do too. I really appreciate your time, and please know that as soon as we get more clear information, that we will push that out to you. I really appreciate your patience from listening to me today, and thank you guys for sharing what you know about the emails you're receiving. I'll tell you, I don't receive the emails. So if you ever want to send one to me and ask me what's up with this, I would love to see them. They won't, I don't know why. They don't want to give me information. No, just kidding. Yeah, hopefully we'll continue to learn more, and I will share that with you as it goes. But I really appreciate y'all's time, and thank you as always for everything you do for our cities.
Thank you, Morgan.
Thank y'all. Have a good one.